important. We've had quite a number of questions that have come in the chat box. And I want to start with you, Aulo. How do we get women at the forefront of agriculture, given that they are often at the background? If you could give a brief answer to that, please.
Thank you, Namukolo, and it's a great question. And I think that's the challenge. The challenge, and it goes down to what Bibi was saying too, is, how do you do it? We found that, there are putting women at the center of interventions can really work and work very well for nutrition. But you need to measure these unintended effects in terms of, potential overburdening and mental health. But if you do it right, you actually make sure that women's role is recognized in the community. So this extra burden is actually valued not just by the women, but by the communities themselves, including their husbands and community leaders, to try and get these positive spillovers to really try and get traction on the ground and really move the agenda forwards on the ground, which is really where we're all trying to do. I hope that addresses the big question. Thank you.
Yeah, thank you very much. And the next question I would like to pass on to Nina. Nina, could you maybe address the issue around measuring resiliency in food systems? Has that been done, and what are the things to worry about in brief?
Thank you for that question. That's a difficult question. Resilience is such a difficult concept to measure, but there are lots of studies on it. Actually, maybe too many to mention, and that's also one of the problems. Everybody sees something else in resilience. How we try to approach this in our work is really practical. We try to really work with local communities and with those vulnerable groups and try to understand how they see their own resilience, both the positive sides of their coping strategies and also their stocks to draw from, but also in terms of their needs and their perceptions on the priorities of in terms of support. So we really try to take a local angle to resilience rather than a very conceptual angle to it, and that really helps also to build local ownership over some of the interventions that may draw from this action-oriented research. I hope that answers the question a bit.
Yeah, thank you very much. Indeed, what you're saying to us is context is important, and we should not lose sight of that. And then I would like to pass the next question on to Filippo. In Rwanda, studies of malnutrition show that boys were more stunted than girls. Did you consider boy/male children as well in your modeling work on cost of a nutritious diet? Over. We might have lost Filippo. Let me take another question for, and then I will take another question for you again, Aulo. From your studies, do you have a long-range plan or project study on how to mobilize women to have good partnership with the men improving their lives?
No, these are great questions. And the two interventions I mentioned, those both in Burkina Faso and in Malawi, really try to have women really at the center of a plan where husbands were as involved in terms of decisions and planning. But really giving a voice to women was really central to both interventions around behavior change. And in Burkina in particular, the whole idea was to be able to give women a role in the spending that the households made with regards to food, so that the whole decision-making process was more equitable and prioritized on the basis of what women thought was important too, not just what men thought. So the idea of developing these joint spending plans for diet really gets to the heart of, I think, what Filippo was also trying to say in terms of allowing enough resources to allocation for specific nutritious foods, and really trying to change those behaviors, at the community level in terms of empowering women to make those decisions. But these are things that really take a while. You don't change these cultural sort of setups in a day. So it's really important to be able to continue with these initiatives to support women's decision making. Thank you.
Thank you very much. And then Nina, did you look at the impact of migration in your study? Because in West Africa, youth are also trying to migrate to Europe, and really, I guess that is their way of addressing their inequity issues. Over.
Thank you for that question. We did not particularly look at out-migration as such as a factor affecting COVID-19 or how that COVID-19 affected the out-migration. But I can imagine that it's, I mean, as was said before, the most vulnerable groups, they were already vulnerable, and because of COVID and other shocks, they are hit hardest. So I can imagine that for those groups, especially youth, there's not so many other options left. We did look a bit at internal migration, and what we did see is that many youngsters who were in cities, who lost their jobs in the retail or in restaurants or in other sectors, they actually went back to their homes in the rural areas and started engaging in agriculture again. So we actually still saw the reverse happening in at least in Ethiopia and Mali and Kenya. We saw that happening. So migration is certainly changing because of COVID-19. Yeah.
Okay, thank you. And then the next question to Dr. Jemima. Is there any study on involvement of men and boys in women's time? Illustrate as you sort of like alluded to, and what is the situation there?
Thanks for that question. There are actually a lot of studies on the involvement of men and boys in not just nutrition, but other aspects as well. I think the earliest studies around men and boys' involvement in gender equality were around sexual and gender-based violence. That has then provided approaches and methodologies to actually do that in nutrition, in agriculture, and in other aspects. So I can share some of those. There's a very interesting study, for example, from Mozambique on a program with Concern Worldwide. There are studies in other countries as well that actually show better outcomes when men and boys are engaged in nutrition. So I can share some of those. There's a whole alliance called the Men Engage Alliance that's part of the NGO Promudo that actually works with men globally for gender equality and women's empowerment and for tackling issues around nutrition, around violence, around land ownership, some of the critical issues that we think are so important for gender equality.
Thank you very much.
Namukolo.
Thank you so much. And I would like to give the last question to Bibi Giose. Somebody loves your statement indicating that we don't need new policies, but also asks, she wonders if we don't want to continue top-down way of doing things, why is this not happening? What is holding us back from doing better than we are now? Bibi?
That's a really excellent question. That's a really excellent question. And I will answer it in 3 points. You see, there is normally an unfortunate perception that the so-called uneducated people are not sophisticated enough to participate and partake in decision-making processes. But this is so sad because, this, does not give the poor and marginalized populations the agency that they require to be part of the co-creation I was talking about. And unfortunately, in the whole, outlook around this, we are missing out on the traditional and indigenous knowledge systems that actually have so much wisdom. We are here not because things started flying in yesterday. We are basing what we do mostly on our cultures and traditions. If we don't go back to the roots, to culture, we shall fail to build back better. So changing perceptions, changing the mindset, and having that inclusiveness is critical. We can move forward, not as a continent and not as a world. Over to you. Thank you.
Thank you very much. So we've actually come full circle towards the end of our session. In concluding, before I give the key take-home messages that I picked up, I just want to say there were a lot more questions than we have been able to address. And earlier I indicated that Twitter handles of some of the speakers will be given, and you can actually look them up on Twitter. Feel free to continue asking them questions and continue the conversation, but they will also answer the questions that have been asked that we did not have a chance to address. So you can actually look them up in a day or so and you will find them. In terms of take-home messages, one first big message that I picked up is the fact that context is really very important, and that in the evidence that we generate, how we generate that evidence and the types of interventions and programs that we then put in place, we need to look at the context. I mean, a good example is what Aulo spoke about in terms of time use under polygamous situation and not. So really, unless you look at the local context, you would not be able to pick up such things. Then the other thing is the issue of targeting, that once this evidence shows us where the challenges might be, that the interventions we then put in place must be well targeted in order to have the intended results, but also that we need to monitor and make sure that our interventions do not necessarily end up with unintended consequences. And then there was the issue of the idea of redistribution of perhaps responsibilities. And I think Dr. Jemima made a really nice comment on the fact that men and boys are really a missing piece in our solutions, so that whatever we do, we need to make sure that they too are engaged and they too become part of offering solutions to some of the equity issues that we have. But finally, I think the issue of equity here has shown that it's not just about necessarily women and girls, but that within our societies, we need to be cognizant of other issues. A lot of our young people who are getting into boats trying to get into Europe are actually boys, and they feel some significant inequity experiences that make them do that. And so we need to make sure that when we think of equity, we are holistic in the different dimensions that inequity takes on our continent. And finally, the implication then is that as we are addressing equity towards cultivating our continent, towards addressing the COVID-19 challenges and other challenges that might come at us, that a holistic approach that looks at different perspectives is actually important. And saying that, I would really want to say thank you very much to our speakers, Dr. Filippo Di Bari, and thank you for sticking with us with the challenges that we faced. Dr. Aulo Gelli, Dr. Nina Duros, Dr. Jemima Njuki, Ms. Bibi Giose, thank you so much for sharing your time and wisdom with us. And I also want to say thank you to people in the background that are helping us that you are not necessarily seeing. Thank you, and